More than a week now after negotiations stalled, a leader at Northern Light Health says there is no update on the hospital system's negotiations with Anthem Insurance.
If the contract lapses, about 30,000 Mainers could be impacted, and other healthcare groups are watching closely. News Center Maine's Christian Harsa has more on what health advocates are saying.
The stalemate between Northern Light Health and Anthem Insurance is not the first in recent years. Chair of Maine All Care, Dr. Julie Peace, says she is reminded of when Maine Health and Anthem were at odds during contract negotiations in 2022.
It feels like an exact replay, to be quite frank.
If no agreement is reached, starting October 1st, 30,000 Mainers will start to see their primary care access change. Policy Director at Consumers for Affordable Healthcare, Kate Endy, emphasizes that emergency care will remain in network.
So if somebody has an accident and needs to go to the emergency room, they don't need to worry about whether or not that's an in-network facility.
She also says Maine law requires health insurance companies to make sure clients have access to enough healthcare options in a region.
I would assume it would be really hard to meet that obligation.
So even without a contract, Northern Light could be covered by Anthem Insurance. However, Endy says cost is a huge concern amongst people calling CAHC because of proposals for healthcare premium increases.
Double digits, 20, 25%, sometimes more, depending on what plan you're in.
Contract negotiations are a factor, but not the only one.
Healthcare costs, so hospital costs, prescription drug costs that are rising.
So it's really becoming a disaster situation.
Contract negotiations have historically been behind closed doors, but talks have become more public and transparent.
And there being benefit to more transparency.
To reduce costs, Endy recommends shopping around for health insurance. One provider is Community Health Options. The Maine-based firm just announced further partnership with Northern Lights to cut down on administrative costs and insurance plans geared towards Northern Mainers.
Just to ensure that they have the care that they need. We want to make sure that we have a healthy state, healthy members, and make sure that they have access to ensure that they remain healthy.
Looking at other insurance might not be perfect.
But again, the vast majority of services are not shoppable.
Which Endy says doesn't make shopping around a very feasible option for many Mainers hoping to lower healthcare costs. Christian Harsa, News Center Maine.
News Center Maine reached out to both Anthem and Northern Light for comment, and representatives at both companies told us they were not available for interviews.